Hi, I'm Dr. Manish Mehta, and this is a Society of Vascular Surgery update on when is the right time to refer an abdominal aortic aneurysm patient to a vascular surgeon. The abdominal aorta is one of the largest arteries in the body and supplies blood to all major organs in the abdomen and the lower extremities, and normally is the size of a garden hose, approximating less than 2 centimeters. Weakening of the abdominal aorta can result in an increase in its size. And when it bulges from 1.5 to 2 times the normal, it reaches more than 3 centimeters, it can be defined as an abdominal aortic aneurysm. Abdominal aortic aneurysms tend to grow over time and are associated with significant risk of rupture and death. Management of abdominal aortic aneurysms is a complex issue and requires comprehensive patient evaluation by a vascular surgeon to determine the risks and benefits of the currently available treatment options for individual patients. Most patients with abdominal aortic aneurysms tend to have multiple other risk factors, such as hypertension, coronary artery disease, hyperlipidemia, and advanced age, to name a few. And traditionally, many of these patients were considered to be high risk for operative surgical repair. However, over the past 2 decades, advances in endovascular technology and critical care have resulted in vascular surgeons' ability to treat these patients with minimally invasive endovascular as well as surgical means to reduce the immediate morbidity and mortality. Not all patients are candidates for minimally invasive therapy, and patients require a thorough workup to determine which procedure suits them best. Even today, most often the diagnosis of abdominal aortic aneurysms is made incidentally by an ultrasound, a CT scan, or MR imaging. And once this diagnosis is made, it can be a very puzzling time for the patients. Management of abdominal aortic aneurysms is complex, particularly since the treatment options have evolved significantly, and a thorough discussion of all the risks and benefits of all available treatment options might require the expertise of a vascular surgeon. So once you have diagnosed a patient with an abdominal aortic aneurysm, please consult with your vascular surgeon to develop the appropriate treatment strategy that provides the most comprehensive care for your patients.
This briefing is made possible by a grant from Cook Medical. To learn more about vascular health, visit vascularweb.org.